Next, we have Amy Mooney, an occupational therapist and mother who has navigated both healthcare and education systems for her daughter with severe ME/CFS. Amy, please start by sharing a bit about your background and then follow up with how you've relied on your instincts to navigate these complex systems, ensuring that your daughter receives the support she needs and deserves.
Hi, thank you so much for this opportunity. I'm an occupational therapist. I'm also a mother for 3 medium-sized kids. They are in the throes of developing who they are and becoming just figuring out where they want to go with their lives. And throughout my middle child's almost 11 years of having ME, she's now 19. So she's had ME for a long period of her time. I have been told that countless times that it's my understanding that's wrong and I'm exaggerating her symptoms or I'm catastrophizing the situation. But I was there, I'm there to witness the heartbreak of her not being able to go to school or attend a sleepover or even eat a meal at the dining room table. And these are things that parents will just take for granted. It didn't take long for me to recognize that it was the medical experts in the school who was misunderstanding the consequences of my daughter's illness, not necessarily me. I was witnessing it and picking up the pieces as she experienced the devastating symptoms of ME. I remember the exact moment my perspective actually shifted from me trying to pull my daughter along to keep up with me and the rest of the family to actually following her lead and listening to her needs. My instincts had radically shifted. And it was at that point that I realized I was the advocate for my daughter's new voice. And she had been telling me and the doctors and the caregivers or the teachers all along what she needed, but no one was really listening. She was a child. How do you really take for granted? How do you understand what a child is going through? But once I believed in my ability to be a caregiver, I began to listen to her actual needs, her story, rather than imposing what I thought they should be. So like I said before, I've been a medical provider for many, many years, but I never really truly understood what it meant to be a caregiver. They're completely different. And to me, being a caregiver is about active listening. It's about respecting another person's needs and supporting their goals. And with this new perspective, after years of listening and learning from the awesome ME community, I began to reflect on how my profession fails to understand ME. And I took a closer look at understanding how the rehab specialists were going about it wrong. This was really uncomfortable. This was not a pleasant experience, but it pushed me to rethink how occupational therapy specifically should really be supporting people with ME and what the proper care should look like, what should be involved. And I was able to take some of that and kind of adjust it to our life. What did my daughter actually need? So you asked about instincts, and I think that's a major component is trusting my instincts. And that meant focusing on my daughter's goals. These weren't society's goals, like Kyle was saying. These were and they weren't even like just family goals. These were her goals specifically. And I found that, you really can't compare them to other kids with ME even, or, even to siblings, even the kids in the same house here. That didn't help. So she was grieving. I was grieving. There was a lot of loss. And my priority had to be to help her find the small ways to find some control and predictability in her new daily life. And also, this was also involving trusting my instincts to recognize her limitations and the limitations in general of this disease. I had to accept that no matter how much We wanted school to be part of her life and part of the plan. It wasn't going to benefit her health right now. So when she was healthier, or when she is healthier, the plan is that she return learning and actually be a better learner. But at this point in the illness process, it was not the right time. So I needed to trust that education is a lifelong journey, and it can take many, many forms beyond the traditional settings of school. And for a child with severe ME, education just wasn't part of the current goal. And it just simply was beyond the capacities for that moment. So how can caregivers really trust their instincts? It's essential. My husband and I know our daughter better than anyone else. And we also needed to protect ourselves from being misunderstood. And whether that means being seen as by outside professionals as, being controlling, or even falsely accused of situations that were possibly abuse or neglect, which were completely false. We need to do things that would protect us as being her caregiver. She was a minor just last year. And so these are my 3 takeaways that I think for those people that have children with ME may be able to benefit. And the first one is to invite as many professionals as you possibly can into your home. That can be a school nurse, or even a nurse at your child's pediatrician's office, a social worker, even your clergy. Invite them into your home so they can start to witness firsthand. It's no longer you retelling the story and recounting the situation, but they now have firsthand knowledge. And number 2 is, whenever you can, let your loved one express for themselves. And it's so hard as a parent. You want to speak, you want to take control and do things for your child. But I've learned you have to let your child speak and let others witness the struggle for them to find the right words, for them to share their thoughts. The medical team, the education team needs to witness this. So the impairment needs to be witnessed beyond just the parents or the caregivers. And finally, documentation is essential. And like Kyle was saying, that writing things down and documenting symptoms and just the overall functional performance is very important, because you need to show that 6 months ago things were different. And sometimes we forget this. We block out things that were really uncomfortable and painful, but we need to be able to document it. And this can be used for disability applications, and also just helps in general monitor progress and decline. And I'm going to make my worksheets available for you all to have access to just give examples. And you can cut and paste and redesign it yourselves, but at least it gives some background of how to start documenting functional performance.
We have just another minute here, but I really want you to touch on, how can caregivers validate their own loved one's experiences and ensure that the voices of that loved one are heard?
Yeah, I think just recognizing those lived experiences, that is their truth. That is your truth. As a caregiver, you witness things that nobody else is experiencing. And that alone is chronic, traumatic stress disorder. I mean, it is deep. And so those lived experiences, in my world, it is one of the toughest challenges of caregiving. And the constant need to have to explain the disease outside of our walls of our home is really exhausting. So I guess I often, we meet that experience, or we meet that resistance most with those that are trying to force the narrative that we aren't living up to their expectations. But I think when we flip it around and start looking outside. There are a lot of people that are in the ME community that share those same experiences. We might not have the same dynamic. We might not have the same age. There are age gaps, but those people have what we don't find in the general population. They have that lived experience if they understand the kind of the code words, and they recognize how big crashes can be, but they also can understand how very minute improvements mean the world. So I think that not looking to necessarily getting validation from the professional medical community, I think looking at who your peers are in the ME community is where validation and lived experiences can be exchanged.
Amy, your unwavering support and advocating for your daughter and bringing awareness to the community's needs, it runs deep and it's felt. Thank you. I've personally learned so much from you, and I hope that we can continue to share that with many others.